Hi, I'm Dr. Sunil Kumar K, Lead and Senior Consultant Interventional Pulmonologist at Aster CMI Hospital. In the first part, we enumerated about the disease burden, your clinical features, what is goal to offer in terms of literature in terms of supporting COPD. In the second part, we'll go to more objective parameters like starting with the spirometry, management goals, and the theme of Gold 2023 for COPD. Spirometry is one of the diagnostic modality which will contribute to the diagnosis of a COPD, where we use this parameter called FEV1 by FEC less than 0.7, and based on the severity of FEV1 we divide into mild, moderate, severe category. As per the freshness classification, you can understand that anybody with 20 years of age will have a maximum lung functioning capacity. Each and every year you pass by, there's a drop in lung functioning capacity. On top of somebody has a habit of smoking or genetic predisposition to have any sort of alpha-1 deficiency can cause a drop in lung functioning capacity to significant. No doubt spirometry is one of the wonderful parameters to even judge the cardiovascular morbidity, where drop in FEV1 exponentially increases the cardiovascular mortality. Every 10% drop in FEVs raises the cardiovascular mortality to the tune of 28%. When it comes to goals of treatment of COPD, it can be divided into short term and a long term. What are the short term measures? Like reduce the symptomatic what the patient can having, increase exercise tolerance, improve health status, prevent and treat acute exacerbation of COPD. What are the long term goals? Prevent and treat complications, prevent the disease progression, and in a nutshell, decrease the mortality associated with COPD. Now, the nutshell for the treatment is bronchodilation. No doubt, in a case of a COPD, we have an airway limitation causing air trapping, causing hyperinflation, causing multiple symptoms of shortness of breath, cough as a predominant thing, where bronchodilators is a key cornerstone for the treatment. Bronchodilators, we have in short-acting and a long-acting medications. You have a long-acting beta-agonistic, long-acting muscarinic action, and inhaled corticosteroids wherever it's indicated. When it comes to management of COPD, proper diagnosis is the key. Smoking cessation, pharmacological therapy in terms of your bronchodilators, and anti-inflammatory medication bunches like roflumilast, antibiotics. At the same time, steroids also comes up an handy option. If somebody has a moderate to severe asthma, as compared to moderate and severe COPD, we have pulmonary rehabilitation. Vaccination also comes up in the picture. And at the level of emergency, needing oxygen and NIV support, determine whether the patient should be admitted in the ward or ICU. To complete the spectrum of treatment options, what we have surgical specialty coming up with surgical lung volume reduction. Because as I mentioned, hyperinflation, nothing but abnormal dead space which is involved compromising the normal functionality of the lungs, can be knocked off by doing a surgical lung volume reduction. Of late, we have got a bronchoscopic lung volume reduction surgeries using coils, valves, and sealants. Last but not the least, when all these modalities are exhausted, I think we have a lung transplant out there in the corner, where at Aster CMI, we are proud to inform that we are also part of our lung transplant team to help these patients to go better. When it comes to future direction, can we have some biomarkers which can pick up disease early, and an ideal bronchodilator which will be easy for anybody to use and has a better anti-inflammatory actions is a challenge. Risk of environment is also one more thing. Environment, keep the environment clean as much as possible. And the bottom line is education at each and every level is a need of the hour. Enumerate of the environmental factors, host factors, medication is a key. I want to conclude the talk by telling that the theme of 2023 Gold, breathing is life, act early. Thank you.